something like this better than the private sector? I mean, anything?
Oh man, oh, you missed my answer. I'm sorry.
Didn't have an answer. Don't have an answer.
So hoping you guys can hear it when I have the answer for you. So a couple things. One is the Medicare. When Medicare, before Medicare went into place, 44% of seniors in this country were uninsured. 44% of seniors were uninsured in 1964-65, and now that number is nearly zero. And it pulled millions of seniors out of poverty. So that's I think a really good thing. In fact, some of the changes to this bill actually extend. Well, the CBO, Congressional Budget Office, says that with changes in this bill, we're going to be able to extend the Medicare Trust Fund by 5 years. And we know the fiscal challenges that are in the Medicare Trust Fund. I'm fully aware of them. But we're looking at this will extend it 5 years. I'd still say that it's not long enough, but I think it's important that we do it. So you asked for one example? That's my example.
Hi Rick, my name is Sue and I'm here with my husband and we both live here in Everett. It just seems to me, watching across our nation, all the people like us that came here tonight to voice our opinions or to listen, it just seems to me that there's so many discrepancies in this bill and there's so many things that I'm hearing you say and I've heard across the nation that it's not clear. You'll get back, you'll look at it. It seems to me you should just throw out what you've done. And get a group of people together, non-biased, professionals, whatever, and start over and cover all of the things that need to be covered and read it. And also, you know, have it clear so us, Joe Q citizen, can understand all the legal mumble jumble. So that's my statement.
Well, look, I tell you, there's a lot of legal mumbo jumbo in legislation, but that's the nature of legislation. And so I think it's important. Your comments are important to me. That's one reason why I and many of us said, look, we're not going to vote on this before August. We need to get home and hear from folks. Take a little more time on this. Now, how much more time should we take on health care?
About 4 years.
Should it be another month?
No, about at least a couple years.
You get it right!
Another 20 years.
Till you get it right!
That'll never happen. Get it
Are
right.
you both even listening?
Are you listening?
Let's be sure about.
Are you listening?
We've been working on health care reform
Can you hear me now?
since at least Harry Truman.
It's in the network. It doesn't have to.
So I read where it may even go back to Teddy Roosevelt.
Yeah.
In other words, we've been having a debate about health care reform and access and costs for quite a long time in the country. And what we're trying to do in Congress is to make changes in the healthcare system that are going to improve healthcare access, and importantly, and I would argue more importantly, the cost of healthcare that small businesses and families are having to experience. These continually increasing costs that are crushing family budgets and crushing small business budgets. I can appreciate people think we're moving too fast. I think in terms of the healthcare reform debate in this country, you know, another 60 years is not going to cut it. I don't think we can wait that long. But that's why we come home. That's why I'm home, taking your comments and hearing from you, and trying to better understand what your concerns and needs are, and trying to get those folded into any bill that we end up moving forward on. And
We're tired of all this.
that guy may have just, I don't know. We'll see. We'll see.
Just say no.
So let's keep moving over here. You know, in fairness, we're getting the white hat, orange shirt. And then we're gonna move down a little bit here. Yeah, good.
Hello, I'm Stella Zeller from here in Bellingham, and I'm with a group for single-payer health care. I think the real debate is between getting the profit motive out so that the money goes into helping people versus the people that want to keep making the profits. And
Profits drive competition.
other civilized countries that put their citizens first. We need to have a healthy citizenry. Everybody should not be for profit when people's lives are at stake and suffering is at stake. We need a not-for-profit healthcare system. Thank you.
So when we come back to this side, we're going to start in this lower section here. But Thomas and Rafika will be making their way over to about, well, if you actually look at the gray panel up here and kind of work your way down, that'll be that kind of section. With regards to single payer, thank you very much for making your case for single payer. I think most folks know that I don't support a single payer system. Nothing like having your friends boo you. But I have a full letter that if folks want it, you know, certainly call my office. We'll send you the letter. With regard to HR 676, which is the single payer bill, there, you know, honestly, that the bill is not. Just as a bill, it's not very well constructed. It's not very well written as a bill. It shouldn't be introduced as it is if it was going to be introduced. There are very vague provisions in there about how to fund it. Extremely vague provisions on how to fund it. It deals with. It says that the benefit package that it describes for people is extremely rich and richer than what most people have. And it bans things like co-pays and deductibles, which are actually important parts of insurance packages to ensure patient participation in their own health care. So there are some problems with it, and I think as well, I tend to be someone who tries to consider whether or not we need to build better guardrails as opposed to, you know, and let things happen within it. For instance, well, there's a lot of examples, but rather than the government sort of taking control of the asset and in terms of healthcare. In other words, I think the hybrid system, the gas-electric system of healthcare that we have, the hybrid system, we need to make changes to it to make it work better. I don't think we need to throw it out and start over. And that's my view. But that's what, you know, some folks are applauding, but, you know, HR 3200 is one way to make those changes to that hybrid system as well. So